All right, we're going to switch gears here, and the Employment and Labor Relations Court has suspended the planned medical health workers' strike that was to take effect after midnight tonight to facilitate an agreement on terms and conditions of minimum safety services. Now, the Kenyatta National Hospital had moved to court seeking to bar doctors working at the hospital from going on strike after the lapse of the 7-day strike notice, even as KMPDU remains defiant with that the strike will go on as planned. Now, KMPDU Secretary General Davji Atellah says the government has not shown a willingness to address the grievances raised by doctors and has failed to honor the 2017 collective bargaining agreement. As our very own Mary Milwaukee reports, opposition MPs led by Minority Whip Opiyo Ndai have criticized Health Cabinet Secretary Susan Nakhumicha for failure to avert the looming strike, terming it a drawback on the gains made in the healthcare sector.
Solidarity forever.
KMPDU Secretary General Davji Atellah says doctors countrywide will down their tools after midnight on Wednesday and will keep from their duty stations until the government honors its part in the collective bargaining agreement. The medics are accusing the Ministry of Health of going back on its word to post medical interns, remit payment for doctors taking postgraduate studies. They are also upset about failure to implement the salary increment as agreed upon in the 2017 CBA. The doctors are accusing Health CS Susan Nakhumicha of high-handedness and neglecting the health docket in favor of political meetings in her Western Kenya backyard.
Today we have a day to destiny. We find ourselves at a critical juncture where we are yet again called upon to put our hands onto the axis of the healthcare systems management in Kenya and bend it towards the correct side.
As KMPDU, we have crossed the Rubicon and we're at a point of no return. The strike notice that was signed dated 6th of March 2024 expires tonight, and we advise our doctors across the country to begin discharging patients and referring them, because the government has been on strike for the last 7 years, and tonight we will join them fully.
The Kenyatta National Hospital has moved to the Employment and Labor Relations Court under a certificate of urgency to bar its doctors from taking part in the strike. Justice Brian Mongaya suspended the planned medical health workers' strike that was to take effect after midnight Wednesday to facilitate an agreement on terms and conditions of minimum safety services. He ordered an inter-parties hearing on Friday, the 15th of March, on recording of a compromise. He also directed the CS Labour to hold a tripartite meeting by noon Thursday, the 14th of March, between the health workers, public service employers and the Ministry of Health. However, the medics have vowed to go on with the strike, saying the government cannot expect them to respect court orders when it failed to implement the 2017 CBA in violation of court orders. The opposition has expressed solidarity with the doctors' strike, accusing the health CS of being out of touch with her docket.
The doctors' strike, which has been called by the Kenya Medical Practitioners and Dentists Union, that is set to commence at midnight, could have been averted. And for the avoidance of doubt, we stand in solidarity with the doctors. Sure. And we demand that the government does whatever it is necessary, first and foremost to avert the strike, but more importantly, to address the issues that the doctors are raising.
The impending strike threatens to paralyze the health sector, with critics terming the government's unwillingness to avert it a contradiction of its professed commitment to attaining universal health coverage. Clinical officers in the country issued a 14-day strike notice, which lapses on the 17th of March. Mary Milwaukee, Citizen TV.